this system, this small device is used either for training purpose or for Whipple procedure. There is a surgery wherein the force is very much critical for while stitching after the surgery. So the Whipple procedure is a complex surgical operation that requires skilled surgeons. So in that, even the skilled surgeons doesn't have the expertise. Sometimes they overdo it, or they don't put a sufficient force for it. So here we are actually the scientist is actually trying to give a numerical feedback electronic system, which will actually tell them or warn them when the force is beyond the critical parameter. Correct. So here the manual is, how it is being addressed today. Usually it is only a manual estimation. There is no electronic data, how much force is required and all. So here we are using the gait analysis, the gait sensors to monitor this thing. So our system offers a real-time suture force feedback with microsecond latency. Yes, it is tested for IEC standards and is actually very much ready for commercialization. In fact, because we have done sufficient laboratory validation. In fact, we have done even clinical validation also in the operation theater itself. We have done the validation, and then the technology is available for commercialization. So it features a battery pack. It is very lightweight and it is easy to handle also. It is very small. The device doesn't occupy a bigger space. It's just like a compact BP monitor machine, a kind of, right? So here the sensors are connected to the console unit, which actually monitors the force and then gives the feedback to the surgeon within a latency of less than a microsecond. So, and once the force is exceeding the threshold, it gives an alarm system to the surgeons. So this is where it is. So now the TRL level is actually 8 because it is actually demonstrated in the operational environment, and we are actually looking for medical device manufacturers who could take up this technology. And there are two avenues for the technology commercialization. One is it can be used as a biomedical training equipment for medicos who wanted to simulate the surgery procedures. And another is real time to be used even for surgeons for Whipple procedure or any complex surgery procedures. So the application is very wide and the market is also wide. So that's it. Any questions? We are open for sale of technology and joint research. Yes, it is possible in other segments, especially in gait analysis and other things. But I don't think for this particular technology, further research is, in case if it is required, we are open to for joint research. Yes. Thank you. We essentially developed a transdermal patch, right? So to deliver insulin, okay. So in fact, I received this proposal day before yesterday, and I'm just presenting it to you. So she has developed the prototypes. One of the challenges for the diabetes mellitus patients is the poor patient compliance, skin infections, expensive actually. It involves hypodermic needles. And sometimes the patient is reluctant to so that they miss the doses, and then the biomedical waste, the kind of waste it generates. So this is what the problem is. 60% of the patients miss injections and 20% miss on a regular basis, right? So here we have developed the device which you can see. It's a kind of a reservoir which will actually send the insulin to the skin epidermis layer. So you can control the dose, and it directly gets into the bloodstream, and the manufacturing cost is also very less. The microneedle is actually a very, very upcoming technology in the medical fraternity, the transdermal patches, right? So the human clinical trials in association with Kaveri Hospital and Mohan Diabetic Center is on, and we have completed the trials in animals. Yeah. So there are very few startups in this microneedle segment, and these are the companies. And the total addressable market in India is projected at 134 million for the diabetes alone. This device is actually used primarily for insulin. In fact, it could be extended for other drugs as well. Yes. And this is patented one. And these are the team members of led by Dr. Srija, Dr. Rohit Srivatsa, Lavanya Pratap, and Vice Principal Dr. Radha. Yes. So this is how we are. The project is actually funded by DST, BIRAC. The clinical trials is done through ICMR intervention, and medical approval is pending. Actually, CDSCO approval is pending. Once it is received, we could go in for the actual commercialization. But even for CDSCO approval itself, we need a industrial partner to do this. Of course, we have finished the trials for the animals, but for the CDSCO approval, we need a company intervention.